What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a COVID test, flu test, maybe it was RSV or some other virus, I hope you have tested negative. If you are currently sick with one of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, April 10th, 2025. If you are new to my channel, welcome to my channel. You just clicked onto the channel that gives you updates on all the viruses that can make us sick. There's a lot of viruses out there. Things are constantly changing with these viruses. Some viruses happen in the winter. Some, such as COVID, can happen any time of the year. Want to stay informed with what's going on with these viruses? Subscribe to my channel down below. Share this video with anyone you know. Of course, give this video a thumbs up to help me in the YouTube algorithm. And of course, leave your comments down below. And don't forget to hit that notification bell. That'll notify you of my latest videos. Alrighty, we have just a few news stories today. Then we are going to do some data from the UK, some data from a few different places. Then we do have some weekly data from here in the United States. Of course, we're going to look at EMS data. And yes, we need to revisit wastewater once again. There's an update on wastewater scan, and it's important that we look at that update today. Starting off today with measles. Yeah, you guessed it. More measles cases. This time, Indiana Department of Health confirms 5 additional measles cases. Remember, was it Tuesday? They just had 1. So now they're already at 5. So, yeah, this is not good to see their measles cases continue to rise. Oklahoma City, a grocery store warns about potential exposure to measles. That's right, there is a potential exposure to measles that took place in an Oklahoma City grocery store. This is in a Aldi grocery store on Northwest Expressway near Rockwell Avenue. The person visited the store between 10 a.m. and 1 p.m. on April 6th. So, hey, if you live in that area and you visited that grocery store during that time, please take note. There was a case of measles potentially within the store during that time. All right, Ontario, things are not going well there whatsoever. Ontario measles case count now tops 800, 155 new infections since last week. Public Health Ontario says there have now been 61 people hospitalized for measles there. I don't know of anyone dying of measles yet in Ontario or Canada, but with this many cases, we're going to have to continue to monitor that situation. And unfortunately, if the cases keep going up and up and up, the potential does exist for that. All right, taking a look at what's going on with wastewater activity in Canada while we're on that country at the moment. Wastewater viral activity level of COVID is low. The wastewater viral activity level of flu A, that's coming in at high once again. Concerning to see that. Flu B is listed at moderate, and RSV is listed in the moderate category at this time as well. So, yeah, flu A, high once again in Canada. Alrighty, we have to take a look at this. Coming back to the United States, something we've already known about, something that we're going to take a look at again, but this is a more recent study. April 9th, CID RAP posted this, and it says, studies. 1 in 7 U.S. working age adults report long COVID, with heaviest burden on the poor. Yeah, long COVID, it's a real problem, continues to be a real problem. You know that, I know that. Maybe you're new to my channel. Maybe you don't know about that. Okay, let's read a little bit about this. Nearly 1 in 7 working age U.S. adults had experienced long COVID by late 2023. And socially disadvantaged adults over 150% more likely to have persistent symptoms, 2 new studies find. Yikes, that's not good. Large-scale government funding is needed. About 35 million adults and 30 million working-age adults, or roughly 1 in 7, said they had experienced long COVID by late 2022 and 2023. Lost wages due to long COVID among working-age survey respondents were estimated at $211 billion. That's billion with a B in 2022 and $218 billion in 2023. So that is a huge number. I mean, at least it didn't grow as much in 2023. 3, but that number is absolutely huge. Just imagine if long COVID was not a thing and that did not exist, how much better the economy would be doing. Well, I mean, with lost wages, there's a lot of people out there that are not going to be um, partaking in the economy because, number one, they're sick. Number two, they don't have the income. People have had to foreclose on their houses. And you know what? You don't hear about this in the news. I'm bringing it up. There's a lot of people that owe serious money on their mortgages right now. I've seen some charts lately, and I have to think long COVID is a big part of that problem. I just have to because, you know what? The number's actually so bad, it brings back memories of a certain time in history. Yeah, 2008, that era. Um, Long COVID could send us that direction at some point. I mean, there are so many people that are just struggling to deal with the finances because of long COVID. They can't work as much, so they're being laid off, they're being let go. They have medical bills, you name it. Long COVID is a serious issue. And I don't know why more people do not pay attention to it and take it more serious. It really needs to be taken more serious. I say this all the time here on this channel. I say it at least once a week. We're talking about something in relation to long COVID, and sometimes it's multiple times a week, and sometimes we even do dedicated long COVID videos. We haven't done one in a while, but yes, this is a real problem, and it needs to be addressed. We cannot just ignore long COVID. All right, moving on to this. Zayn Malik becomes sick with severe illness, cancels concert. It's another one of those performers I'm not familiar with. If you are, leave a comment down below. Hey, I know of tons and tons of performers, but every now and then we come across some that I'm not familiar with. Zayn Malik was forced to cancel his final show of his Stairway to Sky tour after falling ill with a severe case of food poisoning. This is I believe, in Mexico, and he's been so sick that he has just not been able to perform in Mexico City. Malik wrote on his Instagram, he says he's heartbroken to say that he won't be performing tonight in Mexico City. He's been really sick since this morning, and despite trying everything to push through, his body just isn't allowing it. Someone correct me if I'm wrong. I seem to recall we had someone else with food poisoning recently, and we heard about their story. Is this the same one? I honestly don't know. I would have to go back through the archive on my site. It says April 10th, but I do recall someone else had food poisoning recently. All right, moving on to this. Dennis the COVID info guy. New South Wales, this is in Australia, respiratory surveillance reports for week ending on April 5th, 2025. COVID positivity rate, it went up slightly, 3.7%. Number of laboratories reporting COVID. Just 1 out of 4. That's ridiculous. Why can't all 4 report? Ugh. It's a sign of the times. COVID, 1,094 cases. Influenza, 2,014 cases. That's up by 7.2%. And RSV, wow. RSV, not going good here. 2,216 cases, up by 15.2%. This is a little bit different than what we saw in Queensland, where COVID was not going up. But here, COVID did go up. Pertussis, whooping cough, week ending April 5th, 2025. Whooping cough there, reporting, sounds like it's been removed. Okay, rates of RSV notifications per 100,000 ending in week 5. Rates of RSV notifications have been increasing over the last 3 months, with highest rates in children aged 1 year old. New South Wales, COVID-19 whole, this is the sequencing. XEC is at 53% of cases. KW.1.1, which is a subvariant I am not familiar with. I think we read about this one last week, too. I'm going to have to do some research on this one. Is at 23% of the cases. LP 8.1, which you more commonly know in many countries now, is at 12%. It has not taken over there yet, and we'll have to see if it does end up taking over there at some point. All right, moving on now to this. This is an article I found where we learn a little something about Ireland. Is COVID-19 still in Ireland? Latest case numbers, new strain, and vaccine advice. And we do see here that as of 8 p.m. on Thursday, April 10th, there are 48 confirmed cases of COVID-19 in Irish hospitals, with 2 people currently placed in the ICU. And the latest variant there is that subvariant, LP.8.1, that I just mentioned a moment ago. Alrighty, taking a look at the update from the UK, but a little bit of confusion here. Let me explain. First, here's the latest cases. In the UK, they added 1,099 cases. That's down by 38, or 3.3%. Deaths, 77. That's up by 13. Ignore this, up by 20.3%. We're only talking 77 deaths. One death is too many, but we're not talking hundreds. If it was hundreds of deaths and up by 20.3%, then I would be more concerned. In the hospital, 1,005 at this time, and that is down by 22. But here's where it gets a little bit confusing. Take a look at this chart here. By this chart, you would be led to believe that, hey, COVID's still rising in the UK. That's what the chart shows, but we clicked on the data, and it says, well, no, it's not. So either this chart is behind, or the chart is showing something completely different. RSV at this time, RSV, it did go up ever so slightly this week to a 1% positivity rate. Taking a look at what's going on with influenza, influenza does continue to drop, and the positivity rate is 5%. That is down by 1%, or yeah, that is down at this point. And what I was trying to say here was, it looks like healthcare is down by 1 when it comes to influenza. All right, we will get an update from Texas tomorrow on measles. We don't need to look at the national measles page. That will update tomorrow. Nothing really to show you over on the website, but I do want to remind you once again, and I don't have it up here, but I do have a Facebook page now. Yes, Data Report. Type it in there. It is the page for, all my branding, the website, here on the channel, everything I do. Check that out. Data Report over on Facebook. Like and follow that page. I'm hopeful maybe that will grow bigger than my other social accounts. We'll see. I don't know. I want to inform more people of what's going on. Speaking of informing people of what's going on, let's refresh this. Taking a look here at what's going on with bird migration. And maybe it's the first time you see my video. Why do we take a look at bird migration? Bird flu is a thing. We haven't had many stories lately because it's slowed a little bit, but, with all this migration of birds, take a look at this. This is millions of birds. Up to 120 million birds have migrated to the north today. That could potentially spread the virus called H5N1 bird flu. It's very well possible. So we do need to keep an eye on that. We also need to keep an eye on what's going on with air qualities. It's important. The air we breathe in can impact our health. Maybe you have asthma, COPD, or some other respiratory issue. Hey, that can be a problem. Take a look at this. The Great Lakes, not going great today. Neither is portions of the Midwest and parts of the Southeast. Some of this is being contaminated by rainfall, but overall, these are some bad readings. So if the air qualities are that bad, that's not good. West Coast is not terrible, but there are some problems in California, slightly better in Oregon and Washington. We're seeing some bad air quality show up there as well. Taking a look at pollen levels today. Yeah, really bad in the plains. Look at that. From about Kentucky to Tennessee on west into those plains, you can see some reds here. Those are very high pollen levels. Remember to take your allergy medicine. Maybe it's Allegra or whatever it is you take, whatever your doctor has told you to take for allergy season. Make sure you are doing just that. Taking a look at what is going on now in Pinellas County, Florida. This is St. Petersburg, Clearwater, Tampa Bay area, and we see several sick person calls. Not 1, not 2, not 3, not 4. 5 sick person calls, breathing difficulty problems, and some unknown problems, and some fall calls today as well. In Philadelphia yesterday, there were 792 EMS incidents reported. I believe that's about near the same as the previous day. Taking a look at what's going on with Philadelphia's update when it comes to flu, and it looks like this may actually be a little bit behind. We'll look at it anyhow. Flu A is dropping. Flu B at this time in Philadelphia still seeing a little bit of a rise. Hopefully that is going to drop soon. Yeah, this report is behind. It says March 22nd. Matter of fact, let's refresh this. No update. They are supposed to update on Thursdays, or usually that's when I've been seeing it, which is Thursdays. Looking just outside of Philadelphia, taking a look at what is going on with Montgomery County, Pennsylvania. Yeah, there's some calls right now. 13. That's not terrible, a lot. We've seen days where it's gone over 20 at this time of day. So we'll take it, taking a look at what's going on with Chester County, Pennsylvania, if we can. Sometimes you got to hit refresh a few times. And there are some problems going on there. Respiratory difficulty a couple times, heart problems a couple times, and a few other things going on at the moment. Taking a look at what's going on with the hospital situation in Pennsylvania. And we can see, yes, there are some hospitals in the Lehigh Valley with problems. St. Luke's Monroe is having, emergency department overcrowding. And taking a look at what's going on out here, Geisinger, St. Luke's emergency department overcrowding, and something going on further to the north, Lehigh Valley Hospital, Dixon City, behavior health issue going on there. And yes, there's a few other hospitals with problems as well. Taking a look at what is going on in New Jersey today, let's refresh this. And we can see here a psychiatric issue going on at Penn Medicine Princeton Medical Center. That does happen from time to time, and that's their only issue today. Taking a look at New Jersey, emergency department visits and hospitalizations continue to decrease for influenza and COVID, though RSV activity is low. Let's see what this says here. We have to scroll to the right. It says there was a slight increase in hospital admissions this week for that. That's interesting. So they had a slight increase for RSV hospital admissions this week in New Jersey. Recent COVID-19 influenza and RSV hospitalizations have mostly been reported in persons 65 years and older. We can see the test positivity of COVID-19 influenza RSV decreased when compared to the positivity from the previous week. And looks like the predominant strain of COVID there is still the LP 8.1 variant. And get this, the flu type B is now decreasing in New Jersey. New York State for today, 1,298 new cases added. That's higher than yesterday because it's Thursday, and New York City does get added in. Hopefully we get something from the hospitalizations there. No, that has not updated. It's still the previous update of 768 in the hospital, 75 people in the ICU. Taking a look at what is going on in Colorado, COVID, influenza, and RSV hospital admissions all continue to drop. Emergency department visits dropping. Positivity rate for COVID is 2.37%. That's down. Influenza is 4.64%. That's down by over 1.25%. And RSV, 4.86%. That's down by 1.66%, which is really good. Chicago, emergency department visits are low. Influenza positivity rate is 8.1%. Influenza activity is moderate. RSV activity is moderate. RSV positivity is 1.6%. RSV emergency department visits is 0.1%. COVID-19 emergency department visits low. COVID positivity rate, there is what I was meaning to say, is 3%. And look at this. COVID-19 activity in Chicago is now minimal. That is some fantastic news. Alrighty, we have to take a look at the regional trends here from Wastewater Scan, and we're just going to look at COVID. Take a look at this. We can see here, the national trend for COVID. Yeah, it's starting to inch up a little bit. Why? Well, look at this. The Northeast continues to rise, and yeah, it's actually rose a little bit faster, and yeah, the West Coast is rising a little bit as well. No problems at this point in the South and the Midwest. They are dropping at this time, but it's the Northeast mainly causing the problem, and a little bit from the West Coast. I'm going to show you the West Coast a little bit better. And you can see here, for COVID in the West Coast, it's listed at medium. You can see that has inched up a little bit. We'll have to keep our eyes on that. Last year, it was around May, I think, when the West started rising. Remember, we had those multiple rises in the San Francisco area of California. And again, take a look at the Northeast. The rise not only continued, it actually picked up the pace a little bit and is in the high category at this time. So that's relatively concerning. And we hope that trend will change pretty soon. But you know what? The weather's going to be cool, cloudy, rain, maybe even some snow this weekend for some parts of the Northeast. Yeah, that's not going to help the COVID situation. All right, taking a look at some data from CJS 83172, and then that's it for today. Tuesday numbers. Florida, daily cases 285. New York, 750. Puerto Rico, 264. Maryland, 665. New cases and 12 new deaths. Michigan, weekly number, 1,119 new cases and 17 new deaths. South Dakota, 560 cases, that should say over the past 4 weeks. Virginia, weekly number, 1,772 positive tests and 13 deaths reported by the CDC. Wednesday numbers, Florida, 310 new cases and 7 new deaths. New York, 868 cases. Puerto Rico, 193. Delaware, 10 new state reported deaths. Oregon, 10 new state reported deaths. And Washington, 213 emergency department visits and 6 new deaths. Alrighty, folks, that does it for the Thursday edition of the Virus Update. We will have another update again tomorrow with some new CDC data. I do believe we will get new variant data this week. We'll get a whole bunch of other things. We will get it this week. Next week on Friday, we're likely not to get things. I think from midweek on next week, we're going to see a lot of lacking data because of the holiday that's coming up. We'll probably hit wastewater heavy during that period, and news, whatever news pops up. But if you like today's video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below, and don't forget to check out my new Facebook page. Sometimes there on those postings that I do, you know how I post things over on X and Blue Sky? Hey, unlimited character limit over on Facebook. So I might do some more detailed postings there from time to time on Facebook because, hey, I can. Alrighty, I will see you all again next time, which will be tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.